Hello, YouTube. My name is Denise, and I decided that I wanted to share a video that would help anyone who was having a problem conceiving. The reason that I'm doing this video is because I had severe stage 4 endometriosis. I tried IUI twice, it did not work. I tried IVF 3 times, it did not work, and I was told that I would never have kids. I do have a child. I had her, conceived her naturally. She is now 16. And I figured that I should let people know to give some type of hope. Don't give up. Just because your doctor says that you may not be able to have kids, that might not necessarily be true. So, to start my story, I was 17 when they discovered I had severe endometriosis. From the time I was 9 is when I started my cycle, and I had awful periods. I'm talking about every month on the nose, 24 days, every 24 days. That is what I had. Was this cycle. I would cramp, my back would kill me, I would hurt down my legs to my toes. In the pelvic area, I was hurting, I would vomit, I would throw up. You name it, I did it. And I did it for about 2 days, so I would miss school. My mom did take me to the GYN so that they could see, what is going on. She was, of course, aware that girls and women do have cramps, but this was really extreme. So the GYN would not do a examination on me at that time. Now, mind you, this is about 20 years ago. Hopefully they do something different now. But at that time, they would not do an examination because I was 17 and I was still a virgin. Still a virgin was being my sin at 17. So they wouldn't do the examination. That same year, I woke up with excruciating pain on my right side. I was doubled over. I was vomiting. I couldn't stand up. They rushed me to ER. In ER, they did this minor thing to test if I had an acute appendicitis, where they would push in on your body and let go quickly. They said that normally if I had some type of infection there or an acute appendicitis, that when they would let go, I would not be able to stand it and my body would literally jump. And that's what it did. So they prepared me to go into surgery, and they did a vaginal exam. They burst my hymen there, which was another pain that I couldn't even describe, having your hymen burst with a medical instrument. But anyway, they took me into the emergency room. They told my mother that the surgery would be about 2 hours and I would have a teeny tiny scar that nobody would ever see. So my surgery ended up being 16 hours. When they opened me up, they found out I had severe endometriosis, stage 4. For those of you who do not know what endometriosis is, it is when the lining of the uterus somehow travels to the outside of the uterus or other parts inside of the uterus and attaches. So to give you an example, let's say your heart beats, your heart pumps blood. Let's say a little tiny piece of that heart somehow went to your shoulder. Every time your heart would beat, it would beat on your shoulder. Every time your heart would pump blood, somehow it would pump blood on your shoulder. This can cause scarring, it can cause adhesions, and of course it can cause severe pain. Normally, the way that people find out about endometriosis is they have to go through a surgery. So they found out I had stage 4. I had 2 ovarian chocolate cysts, which means that I had cysts on my ovaries that were filled with blood. And if my ovary was to burst and the fluid was to flow through, it could possibly um, fuse things together. Luckily, they were able to clean up all of that old blood and nothing was fused together to my knowledge. So once I woke up, I was immediately put on a combination birth control pill. Now, the pill, the estrogen and the progesterone in the pill is what helps to stop the growth of the endometriosis. I was on this pill for maybe 3 months. I'm going to say no, maybe 6 months. And I went to the doctor and found out that I had a DVT, which is a blood clot in one of the vessels in my leg that could possibly travel to my heart. It could travel to my lungs. It could travel to my brain, and it could kill me. So they immediately took me off of the combination birth control because the birth control is what caused it. If you read on the back of the labels of the birth control, it does say that it could be one of the side effects. So be careful, ladies. That can indeed happen. So I had to go on medication, Coumadin. I believe it was a shot or a pill. I'm not sure. I can't remember. Um, it was one of the two, but it is a blood thinner to help dissolve this clot that I had in my leg. Now, once they got the clot out of my leg, there was the problem of the endometriosis. How do we keep this endometriosis from spreading? So they put me on, over the course of years, I was on some type of birth control pill that did not have estrogen in it, which wasn't the best for the endometriosis, but it was the best that I could have to try and slow it down. I've been on progesterone only birth control pills. I've been on Depo-Lupron. I've been on Provera. I've been on, it used to be called Cinerel, but I believe that Cinerel and Depo are the same things now. But back then, they were just coming out with it, and it was a nasal spray. So what this would do was it would keep my ovaries from ovulating and going through the whole cycle of having a period. So I would not have a period. I did not have a period for quite a few years. I still had some pain, but it wasn't as awful as it was. Now, the doctors informed me that it was slim to none that I would be able to have a child and that I should start having a child as soon as possible. I was 17. I just had this regular boyfriend. Nothing was nowhere serious. But they pressured my mom so much into convincing that that was a good idea. She actually was supporting me somehow going out and getting pregnant with somebody. I didn't. Fast forward, I'm 25. I'm married. I want to try and have a baby. So I go to the doctor. The doctor is aware of my history, and the doctor says, let's try IUI. We skipped over medications because there are pills that you can take before getting into the more invasive procedures. I had there's a pill called metformin. There are a couple of other pills that you could take to help your ovulation be right at a specific time. I did IUI, which is in vitro uterine insemination. This is where they take the sperm, They wash it, clean it, get all the best sperms that they can. They insert it through the vagina into the uterus as close to the fallopian tubes as they can, in hopes that when I would ovulate, this egg would not have to work that hard and the sperm would not have to work that hard to find each other and meet and start to fertilize. I did that twice. It didn't work. I could have done it more, but the doctor was like, my suggestion is if you really want to have this baby, you go directly to IVF. I did. Luckily, at that time, my insurance covered the entire IVF. IVF can run thousands and thousands of dollars. There's medications, there's doctor's visits, blood tests, there's the procedure, there's the washing of the sperm. There's so much stuff that is involved in IVF. And my insurance at that time covered it all. I literally paid $5. And I believe I had 5 cycles that I could try. The first cycle, what happened, according to the doctor, is that they were able to take my egg and the sperm and fertilize it, but the egg didn't divide the way that it should, and then it became fragmented and kind of dissolved. They tried that 2 more times. The doctor on the third failed time told me he was not willing to perform another IVF cycle because he felt my eggs were so bad that I was like somebody who was way past menopause. And I asked him, did he feel that it was any way that I would be able to have a baby? And his answer to me at 25 was, no, you will not have a baby. There is no way possible you will have a baby. So after that, of course, I'm devastated. I started going to acupuncture just to give it a try. The acupuncturist said that she felt that maybe the luteal phase of my period, which is the time after you ovulate until the time that you start your period, was short, since I was having a period every 24 days. I didn't have any type of thoughts of if acupuncture worked, if it didn't. I was just trying. I was desperate and I was trying what I could. So this lady was able to lengthen my luteal cycle by 2 days. So instead of having a period every 24 days, I had it every 26 days. And she thought that maybe, just maybe, that would give a fertilized egg enough time to bury into my uterus versus me starting to shed the lining and inadvertently shedding out a possible pregnancy. I did that for a while, and then I stopped. I talked to my regular doctor and I said, look, I haven't given up. I want to still try. She said the only way that I could try is that I need to have another surgery and clean up all the endometriosis that had developed over the years. So I agreed to it. Now go on to the week of the surgery. I'm going to have my pre-op the next day. My period didn't come. I was like, okay, not really thinking. All I could think of was negative things, was that I was going to go to this doctor, tell her I still hadn't had my period. She would be like, take a pregnancy test. I take a pregnancy test. It was negative, and I didn't want to go through that. So I went and got a pregnancy test. I took it. I actually forgot about it for a while, came back, and it was positive. Couldn't believe that it said positive. So I ran out and I bought 3 more, and I peed on all of them at the same time. All of them came back positive. So needless to say, my pre-op was canceled. But I'm saying all of this to say that I got pregnant on my own, naturally. I have a 16-and-a-half-year-old daughter. Her name is Taylor. There was no complications with my pregnancy, other than I had to take a medication to try to make sure that I would not have any blood clots build up. Other than that, the pregnancy was uneventful. I did have to have her by C-section because at the end she decided to turn upright. But I had a choice. The doctor said that they were able to go in and turn this baby until she was facing the correct way. But there was a very high chance of the cord wrapping around her neck and then me going into emergency C-section anyway. So I'm like, can't we just do a C-section? And yeah, it was that easy. Did the C-section. She came out with all her fingers and toes. She hit all her milestones. She is fantastic in school. She is a teenager doing teenage things. And I am grateful to God. I am also grateful that I didn't give up. Infertility is a horrible, horrible feeling. I know what it feels like to have that period come every month. I know what it feels like that your friends and family are ending up pregnant. I know what it feels like to have to go to a baby shower and act like you're just so overwhelmed with joy. I understand that. I understand the strain that it can put on your relationship. A lot of people aren't able to stay together through infertility because it puts such a horrible strain on your relationship. I understand that the fertility medications make you feel awful, but you're doing this in hopes of a family. So, long story short, please keep trying. I'm not saying that it is 100% guarantee, but I am saying that it did happen to me. And there are other type of GYN situations that people are having, polycystic ovarian syndrome, other types of situations where they don't think that they'll ever be able to have a baby. And lo and behold, after all this treatment and after a couple of months or a couple of years, they end up pregnant. Go figure. But I hope this message has brought some type of comfort to someone who was in need or brought some type of hope. My prayer for all of you is that you will be successful in creating your family. And think of me when you start to feel low. Thank you everybody for watching this video. It is my first YouTube video. Please hit subscribe and also like the video if you liked it. Please leave comments on what I could do better, what didn't work, what did work. I would be very grateful. Thank you very much for watching.